Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, when the pandemic started, we talked about, or there was a lot of talk about how we were going to get through this together and how the country might become more unified. What happened?
Well, John, I mean, pretty clearly, we're here a couple years later, and COVID-19 has become extremely political and a real divider, not at all a unifier. I remember, talking about we're all being in it together, and it really wasn't the case. And John, I think we should talk about that. I'm guessing, not that I don't want us to be united, but my view is probably going to be different from yours on that one. But I want to suggest something we can all agree on to start with, which is that let's ask our listeners to do something really important. Let's ask them, subscribe to CareTalk on your favorite podcast service, and that way you'll be certain to get your weekly dose. This was prescribed.
We are available everywhere. All of you should be subscribers.
Yeah. So, John, I mean, it's undoubtedly the case that COVID has become very political. I mean, why do you think that is?
Well, I think it's context here, David, in case you missed it, is that America's kind of divided already. We've got red states and blue states, and the way communication and politics has worked through mass media is that you've got the centralized channels, the Foxes and the MSNBCs, pushing extreme views of both sides, fracturing the dialogue. You've got social media, the evil social media, David.
Yeah, CareTalk accepted.
Makes a lot of money by cultivating and focusing and rewarding rage or passion, anger or love towards any particular position. And so you've got a toxic mix of political disagreements cultivated by the divider in chief, your buddy Trump. You've got structural communication breakdown where I don't think we all even agree on what the facts or the truth in quotes is. And finally, you've got a massive, endlessly profitable, monopolistic information economy with Google and Facebook and Twitter, all of which I'm sure you've invested in, just focusing on what divides us versus what unites us. I mean, I think that unified conversation is one that it would be great if we could have it, but planting those roots in this toxic garden of disagreement would be really hard.
John, we have talked about, I think both lamented the decline of newspapers, and it used to be everybody get the paper, and there's a value of having an editor who kind of decides what's on the front page, and it gives you something common to talk about. There's something else here that was going on in addition to all the things that you said, which, heaven forbid, I think I'm actually going to agree with, but which is that in the early parts of the pandemic, everyone was staying at home. So they had a lot of time to look at these different media as well. It wasn't just that social media were out there causing divisiveness, and the president, of course, being on TV every day with it, but people were, sitting around looking for something to do, and this is where it was. I was thinking about how this pandemic and this disease are different, being more political than some other ones. And I guess maybe you're saying it's all related to the time factor of where we are in the world. But I think about HIV. It always struck me that this was an illness that mostly afflicted gay men at a time, well before gay marriage or gay rights were mainstream. And yet we sort of took it on as a country, with some exceptions, managed to put a lot of federal dollars against it. And somehow it seems like that would have been a lot more political, but somehow it was less so. I mean, maybe I guess the question is, what would happen if HIV?
You are such an idealist. You are such an idealist, David. At the time of HIV, you forget it was seen as God's answer to men's or women's bad behavior. It was a pox in the late 70s, early 80s, when there was actually a fair amount of social disregard and certainly some members of some right wingers, some folks posing as religious leaders actually said this is sort of God's rage and the cost of bad behavior as they described it, heterodox sexual behavior. And I just, it actually, President Reagan eventually embraced it, but it embraced the cause, and actually Anthony Fauci was around at the time. But if you recall, the advocates were fighting forcefully to prioritize HIV and AIDS as a public policy issue. Much of the public policy establishment didn't embrace it, and to the extent that people had an opinion, it was often, sort of anti-homophobic, dangerously homophobic, and reductionist. So actually, I think that there is you're papering over that. I think we eventually got there, but whether you go back to the 1918, the Spanish flu,
which I don't recall, by the way. I do recall the early days of HIV.
Well, I thought you were around then. But I think the context there is, even in 1918, certain political leaders were fighting mask mandates. The classic example being, St. Louis and Philadelphia at the time were about the same size. St. Louis took its public health responsibility seriously and banned social gatherings at the peak, as it was peaking. Philadelphia, ignoring that, decided to have a Liberty March where they brought together the city. And I think they had the 6 times the death rate of St. Louis with an identically matched population. You had the mayor of San Francisco very famously being willing to pay the fee, if you will, the misdemeanor fine for not wearing his mask. Some of this kind of mask craziness, unwillingness to follow the best public advice at the time, this isn't new. There's a as a French acquaintance of mine said, when you look into New York Harbor, it's not the Statue of Community, it's the Statue of Liberty. And so I think that you're on an area where Americans are prone to push back against government action. I do think this is probably more dangerous now. The divide is more dangerous now, but the divide shouldn't surprise you, David. And the pushback against, hell, the reason we don't even have a decent common public health system in the U.S. is partially because we have a little bit of a live free or die culture in healthcare.
Well, John, you said a lot of things there, and I guess you're trying to sort of cover up the sun there of my idealism and say there's nothing new under the sun as well, although the shade is all out there. I think going back to the discussion about HIV is an interesting one because, as you say, there was a lot of kind of homophobia, discrimination, even this idea about it's God's punishment and so on. But the people that were activists there, they did some really smart things that maybe we can learn from. So, for example, they started by throwing paint, chaining themselves to the fences of drug companies and the FDA and so on. Made a lot of noise, with ACT UP, for example, didn't get that much progress up front. But then what happened is that they figured out how to actually work with the drug companies and with the FDA, got a lot of money for research and development, real innovations, in terms of treatments, and then campaigns on prevention and so on. And then even under, President George W. Bush, he started PEPFAR back in 2003, which I know doesn't go back as far as you like to go, but looking at actually how to address HIV in Africa with treatment and prevention and research, which was good for the world, but also helped to protect the U.S. So the story came out pretty well on HIV, despite some of the calamitous forces that were there, as you described.
So we eventually got there, but HIV didn't affect the population as broadly. It wasn't a pandemic, except within a certain part of the population. I think we're more likely to make progress on that kind of scale problem than we are about broad pandemics. I think the question is really, where do we go from here? If you go back to the divide, we started with a pandemic that was affecting the blue states more than the red states, which you could sort of argue they're in the South and the West, and perhaps they were less reactive because of the burden of disease, and they're more oriented towards liberty and anti-government. But we now see in red states a death rate from COVID that's 3 to 5 times the rate of the death rate in blue states. And if anything, the divides are getting deeper, and we're not coming together like you suggested, and I think correctly suggested happened in HIV. So what do you think is different now?
Well, I think I'm going to give the optimistic view, since you've already painted me as the idealist, as well as being a Trump supporter, which I'm not sure how those two things go together. So let's stick with the idealistic view. And I think there's an opportunity here for COVID to become less political over time. And in fact, possibly even in this coming year ahead of us, 2022. Let me explain why. So first of all, I think with the vaccines working well, it means that the people that are vaccinated are not as threatened by those who, have some other view and are not, anti-vaccine or just vaccine hesitant. And also with new treatments, it means that you don't need such aggressive public health measures. I mean, if it turns out that some of these new pills work as well as they seem to in the lab, then maybe, won't need to wear masks so much. So it won't be so much in your face. And then mandates are actually, even though they stir up more trouble in terms of more divisiveness in the near term, if the mandates are actually upheld and they're implemented, people get vaccinated, they tend to start to reconcile their views with their actions. If they got vaccinated, then all of a sudden, okay, well, vaccination must be good because they did it. And then finally, I think, to go a little bit more on your side, there'll be new things to bash people about, and so maybe COVID won't be so political. That's my idea. That's the idealistic view.
We'll find other things to argue about. I do worry that we're in a very weird period where, the Republican leadership was thinking about, holding up the entire funding of the government because of the president's vaccine mandate. We're in a very odd time. I thought it's going to be interesting to see New York went its direction with a 100% vaccine mandate for every private employer in New York. It's interesting that Mayor de Blasio timed this perfectly, that the mandate will go in 4 days before he leaves office.
Yeah.
But it's there is something too. What's happening in hospitals around America that are requiring vaccine mandates, is there a substantial minority, let's say 5 to 10% that are holdouts up until the deadline. And then the vast majority of people, even the vaccine skeptics, some of them folks are leaving those hospitals, but the vast majority are getting vaccinated. Tyson Foods, red state meat producer, found that with a strong vaccine mandate, it worked. But the politics of the moment, David, make me a little bit more measured. I'm less optimistic than your blue sky happy view of the world.
Well, John,
at the end of the day, most flus are not stopped because there's a vaccine, although there are some examples of that. They happen like the Spanish flu when they burn out with either some combination of immunity plus vaccinations, and I fear that's the path we're on.
Yeah. Well, John, I know, and maybe in another episode, we'll talk about our shared concern about what happens to this country. I am an idealist in terms of being a believer in the United States of America and its constitutional system, and I've been very concerned about it being attacked. And I do worry that COVID is being used as a way to do that. And let's face it, it's not actually a both sides thing. This is more of a Republican strategy, and it's important, I think, that we actually work to try to make it less political, and really partly just for the public health reasons, but also just to hold the country together. And a couple of ideas about how to do that. One is, remember, we had this more gratitude at the local level about the essential workers early on. I think it'd be good to bring that back, and also have some empathy for others' point of view. And let's just say that you were given the example of sort of the blue state, red state, death rates much higher in the red states now. On the other hand, speaking from the more democratic viewpoint, there was this view that there is not a trade-off between kind of restrictions and economic growth, that they go hand in hand. And yet, actually, we've seen probably that's not quite the case. If you lock down more, you're going to have, at least in the near term, some depression in the growth rate. So I think some empathy.
You're on a really important thing. There's a fabulous book out by George Packer where he talks about trying to connect with his he's more liberal, like with his more conservative neighbors. He's kind of afraid of it, but he raises a lot of really great issues. The fact is that a lot of the school shutdowns in blue states did not actually, it would appear, create that much lower infection rate for COVID alpha, the first variation, but significantly damaged kids' access and ability to perform based on their education. So those school shutdowns were not great. I think there are a lot of blue state governors and mayors. The lockdowns did destroy certain businesses and a lot of people's livelihood, and people at a time of already tension and a sense of a loss of control being as part of the Trump chaos chorus of government and the uncertainty of the economy, that they felt even less certain of what was going on and less in control of their lives. And I think that triggered a level of anger that there's a longer tail of than I think a lot of the blue state leaders recognize. And you saw that in how thinly Governor Murphy of New Jersey won, even though a lot of people approve of the way he handled it, COVID. He kind of shut the state down. And you're seeing pretty high favorability among red state governors who kept states open. There's definitely more middle ground than either political leader would suggest, because it feels like people are kind of locked into positions.
Yeah.
Shut down
or not, vaccine or not. So John, the thing is, I think what we're willing to say, and we're both registered Democrats, or at least last time I checked, you were as well. And yeah, not everything the Democrats did was the right thing. Now, you have to have a ability to actually have that discussion and to feel that somebody who's, maybe registered a different way would also not just say, hey, see, you were wrong about everything, you're wrong about that, but actually to have a more common discussion about where we actually go so that we can improve and get on the right track and have some shared goals. That's what I want to get back to. Now we have to wind the clock back some years to get to that point, and it was never completely there.
Well, I think the reality, David, is it is there, but we're going to have to define that common ground, and perhaps it's around the flag and patriotism. It certainly does feel like Russia and China and others are looking to knock us off the block as the global leader, and that might actually shake us into a level of focus on common purpose. There is a real battle for freedom and liberty across the globe that we, as the leaders of the free world, as America, really are responsible for. And I think perhaps that'll get us there. But right now, the progress is grim. And I think if we're going to be optimistic about anything, it's that the healthcare system is delivering. We actually do have vaccines that work. We're getting fast information on boosters. Omicron is scary, but it's not that scary because we've got vaccines and boosters, a system that's dialed into sequencing and understanding the genome, the damaging genetic profile of these pathogens, but also we're creating therapeutics. We're tweaking the therapeutics for everything that comes. We've got a system that actually is in the developed world. We're getting the best out of our healthcare system, and I do think if there's optimism here, David, and what perhaps could bring us together is the fact that the healthcare system, whether you get COVID or you get vaccinated or you get lucky, is going to be there to keep people healthy. And that is something I think we should be grateful for. And the American healthcare system is delivering.
Well, John, my mandate for you is going to be stay positive and test negative. In any case, that's it for yet another edition of CareTalk. We're talking today about sort of a meta topic about whether COVID-19 is political and how to make it less so. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrics. While we focus a lot on what pulls us apart, there's a lot that brings us together. So let's focus on what the healthcare system is doing well, how we're going to survive and thrive through the pandemic. And for those, all of you out there who are surviving and thriving, please subscribe.